there are a lot of people who do not benefit from any known treatment. So the greatest benefit, in fact, is that TMS, and especially the repetitive TMS, can actually provide a new form of treatment. We don't know how effective it is yet. We do know that there are some magical changes that have happened in people, but overall there is an issue of trying to find a decent approach, particularly toward those pain conditions for which we have very little evidence from any treatment otherwise. As an example, we do have people both who have had central post-stroke pain and who have had chronic facial pain for years, for which no other treatment seems to be helpful. Two cases spring directly to my mind. One is a patient with central post-stroke pain who actually was in dire straits, both socially, psychologically, and pain-wise, and she had to drop out of college following TMS, following some one-year treatment of TMS. She went back to the college and very recently actually finished her PhD studies successfully. Another case that we have is a pain patient, mainly with facial pain, who we treated for repeated sessions of RTMS for a year and a half, so that her pain almost completely disappeared. We then followed her up for 6 months and the pain never occurred. So the possibility here is that TMS somehow set in motion a process that then led to a more permanent pain relief. And we are actually quite keen to try and find out why that might happen. We suspect that the reason is somewhere in the neuroplasticity that has become established in a positive fashion. I personally think that novel brain imaging methods and novel neurophysiological methods can help us to delineate some very important factors that lead to a good or a lesser successful response. So such clinical evaluation will probably eventually involve the use of neuroimaging and other methods to see if the patient is responsible to this form of treatment, and that can happen as a matter of routine investigation for any patient who is considered a candidate for this treatment.